Hello everyone, welcome to my another video. Today we discuss about a special MCQ for upcoming NORCET 2023. This is part 10. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 91. How should a nurse expect a client's anxiety to be manifested physiologically? Option A, constricted pupils. B, narrowed bronchioles. C, decreased blood pressure. D, increased blood glucose level. Right answer is option D, increased blood glucose level. The fight or flight responses of the sympathetic nervous system are stimulated, causing an increase in blood glucose through glycogenolysis and gluconeogenesis. The pupils dilate, not constrict, to facilitate the entry of visual stimuli. The bronchioles also dilate, not constrict, to facilitate gas exchange. And the blood pressure increases, not decrease, to shunt blood to vital centers. Next question. A client's admitting history indicates signs of akathisia. What clinical finding should the nurse expect when assessing for akathisia? Option A, facial tics. B, motor restlessness. C, maintaining a body position for hours. D, repeating the movement of another. Right answer is option B, motor restlessness. With akathisia, the client exhibits a constant state of movement. This is characterized by restlessness and difficulty sitting still, including constant jiggling of the arms and or legs. The distortion of voluntary muscles such as tics, spasms is known as dyskinesia. Maintaining a body position for hours is a form of catatonia known as waxy flexibility. Repeating the movement of another person is known as echopraxia. Next question. What is a nurse's most appropriate action when a client is seen openly masturbating in the recreation room? Option A, restraining the client's hands. B, putting the client in seclusion. C, escorting the client out of the room. D, teaching the client acceptable behavior. Right answer is option C, escorting the client out of the room. This accepts the client but rejects the behavior. The nurse should set limits on this behavior when it is not performed in a private area. Restraining the client's hands is unrealistic and violates the client's rights. Putting the client in seclusion is a punishment rather than a setting of limits. Teaching the client acceptable behavior, this is not applied because the client may be too anxious at this time to understand a conversation about acceptable and unacceptable behavior. The nurse has a responsibility to the other clients to limit the behavior. Next question. A nurse's best approach when caring for a confused older client is to provide an environment with option A, space for privacy, B, group involvement, C, trusting relationships, D, activities that are varied. Right answer is option C, trusting relationships. A one-to-one trusting relationship is essential to help the client become more involved and interested in interpersonal relationships. Privacy usually is not an issue for a confused client who requires increased supervision. A confused individual needs to start with a one-to-one relationship before progressing to group involvement. Selected activities rather than a large variety of activities are best. Next question. What client response indicates to the nurse that a vasodilator medication is effective? Option A, pulse rate decreases from 110 to 75. B, absence of adventitious breath sounds. C, increase in the daily amount of urine produced. D, blood pressure changes from 154/90 to 126/72. Right answer is option D, blood pressure changes from 154/90 to 126/72. Vasodilatation will lower the blood pressure. The pulse rate is not decrease and may increase. Breath sounds are not directly affected by vasodilatation, although vasodilator medications can decrease preload and afterload, which could indirectly affect breath sounds and heart failure. The urine output is not affected immediately, although control of blood pressure can help preserve renal function over time. Next question. For which common complication of myocardial infarction should the nurse monitor clients in the coronary care unit? Option A, dysrhythmia, B, hypokalemia, C, anaphylactic shock, D, cardiac enlargement. Right answer is option A, dysrhythmia. Myocardial infarction may cause increased irritability of tissue or interruption of normal transmission of impulses. Dysrhythmias occur in about 90% of clients after an myocardial infarction. Hypokalemia may result when clients are taking cardiac glycosides and diuretics. This is a complication associated with therapy, not a pathologic entity related to the MI itself. Anaphylactic shock is caused by an allergic reaction, not by an MI. Cardiac enlargement is a slow process, so it will not be evident in the coronary care unit. Next question. A client is admitted with suspected atelectasis. Which clinical manifestation does the nurse expect to identify when assessing the client? Option A, slow deep respirations, B, normal oral temperature, C, dry unproductive cough, D, diminished breath sounds. Right answer is option D, diminished breath sounds. Because atelectasis involves collapsing of alveoli distal to the bronchioles. Breath sounds are diminished in the lower lobes. The client will have rapid shallow respirations to compensate for poor gas exchange. Atelectasis results in an elevated temperature and it results in a loose productive cough. Next question. A client receiving TPN reports experiencing nausea, thirst and a headache. Which clinical factor should the nurse monitor initially to further assess the client's status? Option A, blood glucose, B, urinary output, C, blood pressure, D, oral temperature. Right answer is option A, blood glucose. The client is exhibiting classic symptoms of hyperglycemia and simple serum glucose monitoring evaluated by a glucose monitoring machine will help guide the nurse's next action. Urinary output is a useless assessment. It must be evaluated in relation to intake. Assessing the blood pressure may be a secondary action to assess for overhydration if headache alone were present rather than the classic signs of hyperglycemia. Taking the blood pressure might be the initial action. Oral temperature monitoring is unnecessary. The symptoms do not indicate infection. Next question. Number of mitochondria are less in option A, red fibers, B, myosin, C, white fibers, D, actin. Right answer is option C, white fibers. White fibers have comparatively less mitochondria but similar mitochondrial composition. Next question. Which of the following has no nucleus? Option A, RBCs, B, WBCs, C, lymphocytes, D, monocytes. Right answer is option A, RBCs. The nucleus is the central center of a cell. It has DNA in it which is required for the reproduction of any cell. RBC has hemoglobin in it which carries oxygen. The RBCs don't need to reproduce as simply more RBCs can be produced by the red bone marrow in a process called erythropoiesis. So this is the today's video. Thank you so much for watching my video.